Volume okay? Okay, well, thank you all for coming today and joining us on this wonderful occasion. Great turnout. It's great to see so many of our community partners and supporters and staff that have been part of developing this program and expanding it to what it will be and is today. And so we've got great news with the opening of the Wellness Center that will serve children and adolescents and provide behavioral health services. Today we choose to officially announce the expansion of our program for a couple different reasons. First of all, the Wellness Center symbolizes a place where families can make their lives better. This is where our new therapists, which we've hired 3, will be part of this program. We'll see our young patients. We also will be expanding our services in our Brockport location. We're not having a ribbon cutting there, but we've added a special program for our children as well in that location. So we'll have services in both Orleans and Monroe County, focused in the children and adolescents. I see so many of our partners here today. Paul, our public health director, we were just having a meeting probably about a month ago, and we were talking about our county rankings and how many opportunities are in front of us. The things that we can change in this community that are at our arm's length, things that we can be part of, and this is just a start by opening this wellness center. This center will bring to the forefront ways for our children and adolescents. We have some of our schools here, representatives, our superintendents, ways for our families, friends, and neighbors take part in this. Oh, sorry. Probably don't need these anyways, but this program will focus on the children. So much of what we're here for, right? Most of us have children or have family, friends. Many of them are challenged with just managing day to day. How do they cope with things? How do they live in trauma? So many of ours are facing trauma, poverty, this crazy world, the pandemic, and this will be a safe space for those children. Somebody to listen to, help figure out how to make a better person out of themselves. And so aside from that, we are also celebrating this week our National Health Center Week. So we are 51 years old this year. So last year, many of you participated in our 50th anniversary, so 51 years. But for our National Health Centers, once a year we recognize all of the health centers across the nation, and we dedicate services to our patients, to our staff, to our providers in recognition for serving the underserved and the special communities that we're here to reach. Oak Orchard served over 30,000 patients last year. We have services across Monroe, Orleans, Genesee, Steuben, and Wyoming counties, serving over 100,000 visits. And with this new site, we're going to continue to expand those visits, and hopefully with all of your partnerships, we're going to continue to refer children here, and we're going to get those children better and hopefully help our community grow and be more sustainable. So that's pretty much my talking points. So now the next thing is, I want to recognize a lot of the officials that are with us today that have taken time out of your busy schedule. So first of all, Governor Hochul's office is here. J.W. Cook, where did we go? Come on up here. So New York State has a proposed prevention agenda out there this year that's going to start in 25. And we're excited because this new prevention agenda is different than prior agendas. Usually it's about improving chronic conditions, and that's on the list and that's important. But really forefront to that is economic well-being and mental health well-being. And those are different things that we need to focus on in order to make this community better. And this health center is going to be part of that. And so, J.W. Cook, I'll give you the chance to say a few words, and thank you for being with us.
Fantastic. Thank you so much for having me. Good afternoon, everyone. I would like to first thank Karen and the entire team at Oak Orchard for inviting me to speak today. I'd also like to take this moment to recognize some of the wonderful elected officials that we have in the audience that are committed to this work and that represent this community. I'd first like to start with Assemblymember Steve Hawley. Thank you for joining us today. We've got Orleans County Chairwoman Lynn Johnson here. On behalf of Senator Schumer, we have Bernard Alexander. Bernard. On top of that, we have New York State Senator Robert Ortt's representative, County Legislator Skip Draper. And then we also have County Legislator Ed Morgan in attendance as well. That being said, again, my name is J.W. Cook. I'm the Finger Lakes Regional Representative for Governor Hochul. I'm honored to be here with you today with a citation from Governor Hochul, marking this milestone for Oak Orchard and for mental health access in our region. The past few years have presented unprecedented challenges. While many aspects of our lives have gradually returned to a sense of normalcy since the pandemic, we have witnessed a growing need for mental health services, especially among our children and adolescents. This need is not just a fleeting trend, but a lasting cultural shift that demands our urgent attention and action. Since the start of the pandemic, I'm told that Oak Orchard has seen a staggering increase in the demand for behavioral health services, 119% across all visits and an extraordinary 164% increase in pediatric visits. These numbers are not just statistics. They represent the children and the families in our rural communities who need help. The Brockport and Albion facilities have been at the forefront, serving many of these young patients. However, with this great demand comes the challenge of longer wait times, something no parent or child should have to endure. That's why today's ribbon cutting is more than just a ceremonial gesture. It's proof of progress for our families, and I know Oak Orchard is committed to that. Having grown up in Brockport, hello, Dr. Getz, I have seen firsthand the impact Oak Orchard has had on our communities and what an expansion behavioral health services will mean for our communities. Through in-person visits and telehealth visits, this program will make a difference in the lives of so many young people struggling with mental health issues. As we cut this ribbon today, we are opening a door to a better health, hope, and brighter futures for the children of our community. Thank you once again, Karen, for inviting the governor's office to help celebrate this important day. We're proud of Oak Orchard's continued commitment to our community and the families that you all serve each and every day. So thank you so much again. And now I'll present the proclamation. Back to you. So on behalf of Governor Hochul, we have a nice citation issued from Albany. Here you go. We can just take a photo. Thanks.
Perfect.
Thank you so much.
Let's see if the wind will get us here. Okay, thank you so much, JW. So our next representative with us is Bernard from Senator Schumer's office. That won't work. Thank you, Bernard, for being with us today and representing Senator Schumer's behalf. And I'll give you an opportunity to say a few words.
Thank you very much. Thank you for having me. Good afternoon, everyone. My name is Bernard Alexander. I'm the Deputy Director for Senator Schumer's Rochester Finger Lakes region. I'm honored to be here today to celebrate the expansion of Oak Orchard's Child and Adolescent Behavioral Health Program. This is a significant milestone for our community, and I'm privileged to speak on behalf of Senator Schumer here today. First and foremost, I would like to commend Oak Orchard for its unwavering commitment to providing comprehensive, high-quality healthcare services to our children and adolescents. This expansion is a testament to the dedication and hard work of everyone involved in this organization. As many of you know, Senator Schumer has been a staunch advocate for improving health and healthcare access across New York State. So today's ribbon cutting is more than just an expansion of the facility. It represents hope, progress, and a brighter future for the children and adolescents who will benefit from these services. It underscores Oak Orchard's commitment to building a healthier, more resilient community where everyone, regardless of their background, has access to the care that they need. On behalf of Senator Schumer, I extend our greatest gratitude to Oak Orchard for your continued dedication to improving the lives of our community members. Your work is invaluable, and today's expansion will undoubtedly have a lasting impact on countless lives. I would also like to take a moment to read a proclamation from Senator Schumer recognizing this significant achievement. Whereas, since its inception in 1973, Oak Orchard has grown into an integrated health system serving countless patients at 11 locations in Monroe, Orleans, Genesee, and Wyoming counties. The center provides primary pediatric, vision, and dental care, as well as behavioral services. And whereas the Wellness Center at Oak Orchard Health's expansion will allow for the continued care of patients and members of such a hardworking community. The impact of Oak Orchard's work can be felt across the entirety of our great state, and therefore, be it known that Senator Charles E. On behalf of Senator Charles E. Schumer, do hereby recognize and offer my most sincere congratulations to Oak Orchard Health and those gathered here today. I am certain the Wellness Center at Oak Orchard will continue to serve New York in all future endeavors. Thank you. And congratulations once again on this remarkable achievement. Here's to many more years of success. We'll get a better one.
Okay, perfect. Thank you, I appreciate that. We'll slide this in here. For now, and then we'll go from there. How about that?
That sounds good.
Okay, perfect. Thank you so much, Bernard. Some of you know Skip Draper, a local Orleans County gentleman. He's here with us today representing Senator Ortt. Thank you, Skip, for being with us today and give you the opportunity.
All right. Well, Karen, it's a pleasure to congratulate you as well as your staff on this milestone and all of the accomplishments of Oak Orchard Health. In fact, 3 of the counties that you serve are in his district. So I won't read you all the whereases, but I will read you what he wrote. I, Senator Robert Ortt, and the New York State Senate do hereby recognize and extend our most sincere congratulations to Oak Orchard Health for the expansion of their child and adolescent behavioral health program, and wish you much success, and know that he's extremely proud of what you do.
Thank you very much, Skip.
Yep.
Thank you. Skip, let's grab a picture.
Okay, sure.
Here we go. Thank you.
She's in charge.
Okay.
Thank you.
Thanks, Skip.
You're welcome.
Great. Great. And next I'd like to bring up Steve Hawley, our Assemblyman. So he represents many of our communities and has been a strong advocate for Oak Orchard Health. We're always grateful when he can attend our event, and it means a lot to us that you're personally here. So, Steve, come on up.
Please, no applause. Sometimes, oh, it is working.
It is.
I'm short, but I'm not getting up on that stand. I do watch a lot of Rochester TV and occasionally Buffalo as well. And I watch oftentimes Channel 10, and the sports director, the guy that reports almost every night, at the end of the TV at 11 o'clock, at the end of that half hour, if you look as they pan away with the TV, that guy is standing here, and he's still not as tall as the other 2 reporters, the anchors. So I'm much taller than him. I'm going to just stand right next to Karen. The pandemic, as we all know, affected every single segment of our population. It affected people that were just born. It affected people that were just starting school, 3, 4, 5 years old if it was preschool. It affected those that were in middle school, and it didn't matter whether it was public or private. It affected high schoolers, and it affected those going into college. And that's what we're celebrating here, if you will. We're celebrating the ability to help those who kind of have lost their way since that pandemic, some more so than others. And so to be able to help them in their time of need, here not only in Orleans County, but over in Monroe, Brockport, as well as in Wyoming and Genesee, is something that we want to thank Oak Orchard Health for doing. You do it in so many other ways, with health care for all, and what you're doing here today with ribbon cutting for behavioral health for young folks and adolescents is something that should make the heart grow fonder of Oak Orchard Health. So with that, I have a very short proclamation. It's actually a citation. I will not read it I'll just give it to Karen and you can take a look at it later. And on behalf of the citizens of the 139th Assembly District, we thank Oak Orchard Health for what you're doing and all those that work here. Congratulations.
Thank you, Steve. Oh,
Picture?
yes, sorry. You know this process.
This is the picture.
Perfect, thank you.
Thank you. Okay, thank you, Steve. Next, I'd like to invite Lynn Johnson, our chairwoman of our Orleans County Legislature. She's been a great supporter for our program for a very long time and such a committed person for this county.
Thanks,
Lynn?
Karen. Oop. We do have a ledge there.
Yeah.
Thank you, Karen. My name is Lynn Johnson. I'm chairman of the Orleans County Legislature, and it's my pleasure today to be joining you as we celebrate this Oak Orchard Health Clinic, especially while it's Health Center Week and the expansion of the child and adolescent behavioral health services. There can be little doubt that behavioral health issues, as everyone has said, was recognized since COVID-19. But I think that just put a spotlight on an issue that we've already been suffering with, and it just made it more apparent, and this will hopefully get to the root of that. I also think in a world of constant connectivity, people have lost touch in conversations with each other, and they hide behind an anonymous keyboard, and they feel more isolated and alone than they ever have. So it's why I'm so grateful of Oak Orchard's expansion. Indeed, I not only congratulate you for today's event, but I offer my sincere thank you to the entire Oak Orchard team for stepping forward to meet a great demand that we have here in Orleans County. Thank you. And I also have a proclamation. I guess we need a picture. Skip is laughing at us.
Thank you, Lynn, so much. Okay, I would like to make an honorable mention of all of our board of directors who volunteer a significant amount of their time to lead the direction for our organization. I'd like to call them out. If you could just stand up. Nyla Gaylord. Cinda Watrava, Nicole Morrissey, Randy Dumas, and Anthony DiBenedetto. Our board is a little bit different than a lot of other boards. It's a patient majority board, which sets us aside from a lot of other organizations. And so we're probably at about 70% of our board that are patients. And it's really important for us because to get that input from our board, who's helping us set direction, is taking into account what our patients need in our community. So thank you, all the board members, for your time and commitment. Okay, next I'd like to introduce Robin. I think you're up next, right? Robin is our Chief of Behavioral Health. She has spearheaded this program since inception. She has been with the organization for several years, and this is her new baby of this opening of the Wellness Center, and she has so dedicated to our population, the services. She's got a great team, which a lot of them are in the audience, and you might get to meet as we do the tours. But let me give Robin an opportunity to talk a little bit about how this started.
Great, thank you, Karen. You know, I'm sure I am going to come up on here, I think. All right, here we go. So thanks so much, Karen. This is a really exciting day, especially for many young people and families in our community. As many of you, of course, know, and has been talked about today, children and adolescent mental health and getting connected to services was challenging even before the pandemic, and certainly the volume got turned way up after that. especially in rural areas. Oak Orchard Health, so this program, we've seen more than double of the number of child and adolescent pediatric visits since 2020. I know we talked about those statistics earlier, but it's really alarming. And so, with that is really the reason that we're all here today. The demand is not slowing down, and part of our role as a community health provider and a safety net provider in this community is to meet that demand and to identify it and see it and meet it, and that's what we're doing here today. With this expansion, our team will be able to provide vital behavioral health services to our children and adolescents in Albion, Brockport, and the surrounding regions. This will reduce wait times and really provide access to care that's closer to home. This program would not be possible if it wasn't for our partners in the Western Monroe County Child and Adolescent Behavioral Health Coalition, which have worked collaboratively for many years to make this a reality. I want to take this time to recognize the University of Rochester and Dr. Michael Scharf, Rochester Regional Health and Caitlin Brady, SUNY Brockport and Dr. Claudette Brown-Smythe and Summer Reiner, and Brockport Central School District with Lynn Carriger and Superintendent Sean Bruno for their efforts and continued investment in the work of this coalition, which has been going on for many years. I would now like to introduce Dr. Michael Scharf, the psychiatrist in chief at URMC Golisano Children's Hospital and the chief of the Division of Child and Adolescent Psychiatry. Dr. Scharf has played a really pivotal role in that coalition that I just spoke of, and I know he'll talk a little bit about that. But really, this is years in the making of us really coming together, working in partnerships, and identifying the need and trying to determine how do we help meet that. So welcome, Dr. Scharf.
Thank you, Robin. Well, thank you very much. I do not need the stool, but I do need notes. Not because I have an exhaustive speech, but because the name of our group that you just heard said very quickly, the Western Monroe County Child and Adolescent Behavioral Health Coalition, is sort of a mouthful. And I wanted to make sure I wrote down the initials. It's a group that came together in the context of what you've been hearing about, a children's mental health crisis that's really was identified nationally in 2015 and has unfortunately continued to get worse, not better. There can be no health without mental health. Folks who work with kids, who works with families already know that. And we're very fortunate in our broader community, in our region, to have a champion for children's health in Jim Getz. Jim, before 2015, was an advocate for holistic child health. I actually first met Jim when I was still a trainee, and I presented grand rounds in the Department of Pediatrics at U of R. And then we came to get to know each other even better as he continued to seek out more training and ultimately more services to support children in this region. When we started to get really organized to ultimately to create the WMCCABHC, this region was at a point where there was not a single child psychiatrist seeing patients from the site of Rochester General Hospital all the way to Batavia. We came together, ultimately coining this phrase, and honestly, it was sort of in the context of making fun of long acronyms, so we got the longest. But the idea was to be centered in community. There's no health without mental health. You can't support children's health without supporting families, and you can't really effectively support families without supporting community. And really, that's the theme of what Oak Orchard is about, right? We hear about the number of sites, the number of counties, but each of those is about supporting a community. And we generalize, and it's efficient to generalize, but each of those 11 sites, each of those communities has a unique identity. I'm very proud for having had the opportunity to work to expand services in the way we did in Brockport. And the way we did it was not just the U of R and Oak Orchard, or Mike Scharf and Jim Getz. We reached out to everyone. It included Rochester Regional. It included the school district. It included SUNY Brockport. A true coalition of the willing, if you will. And the first grant we had, I referred to as the kitchen sink grant, because every idea we could add in that someone could contribute, we managed to put together. It's really become a demonstration for now bringing expanded community-based and ultimately coordinated with what would happen in the larger area specialty center, community-based supports for families and children to get to a point where all children can have access to mental health care and support when they need it. That's our goal, and I'm really proud of what we've done in this region and in this community. And I'm delighted to have the opportunity to introduce Jim Getz. Jim has become a good friend, a good ally, and really we are like-minded in terms of the idea of seeing every opportunity for advocacy to promote children's health. He's been an inspiration to me. He's been at times a dogged reminder to get the stuff done that I said I would do. And he's just been a great partner to role model the qualities of supporting community and of collaboration and the outcome of children's health above the ideas of who takes credit and self and individualism. I'm proud to introduce Jim Getz, and I'm proud of seeing the work that's culminated with the opening of this center today. Thank you, and Dr. Getz.
You forgot to add the pain in the neck phrase. Thank you.
Yep.
Health centers are different from other medical providers in several ways, but one important way is then when we see patients, when we see our community people, we try to say, well, what's going on here? And years ago in the pediatric office at Brockport, it was clear that we were seeing many more kids and adolescents with mental health issues than we had in the past. So our mission in health centers is to identify these things and then try to do something about it. We've done it in like with hypertension, we've done it with obesity, we've done it with smoking. So now we had mental health, child and adolescent mental health. I'm a pediatrician, so that's what I was mostly interested in kids. And we got together in a room, as Dr. Scharf mentioned, at the Brockport office, the people that I thought were important in this effort, and that would be the Department of Child and Adolescent Psychiatry at the University of Rochester, the Assistant Superintendent of Schools at Brockport, the head of the Medical Services and Mental Health Services at SUNY Brockport, the CEO of Oak Orchard, the Medical Director of Oak Orchard, and we met and came out with two things. One was that great long name that I think, Mike, you suggested. So the Western Monroe Child and Adolescent Mental Health Coalition. This coalition, by the way, met every month for 3 years. And it, I think, continues to meet now. Does it, Robin, still once in a while? But it was monthly for 3 years to try to work out the various things that would happen. And then the thought was, if we get this thing going, let's export it to our other sites. Here you go. So we saw, the first meeting, by the way, was in March 2018, 6 years ago, well before the pandemic. We saw 15 patients in 2018, over 500 the next year, and almost 4,000 patients last year. So clearly, we're being somewhat successful, but the downside is there's a waiting list of over 2 months. So we're not meeting the need. And what Robin said about hiring more staff is exactly what we have to do. So we're doing that, and we're being successful at that. That's a wonderful thing. I think, like Dr. Scharf said, I've been practicing pediatrics for half a century. And I've come to the conclusion that mental health is at the center of overall health. If you have resilience, if you have a good sense of who you are, if you have hope for the future, you're going to do okay with whatever life brings you. We've all been there. We've all had something to deal with. On the other hand, if you're depressed, or if you're anxious, or something worse, and you have an illness of some type, you're probably not going to handle it as well And it's going to be a lot more serious and take a lot longer to get over than if you had good health. So what we're doing here, mental health services for children and adolescents, is extraordinarily important. It's been 6 years since we started. I'm a pediatrician, so I'm going to make a little pediatric analogy here. So going from taking those first steps 6 years ago, now we're graduating kindergarten. We've come a long way. We've done a lot of things, but just like graduating from kindergarten, we have a long way to go, and the best is yet to come. Nice job.
Thank you. And we have one more representative here with us, Marie Manjan, who's from Chicanes, which is another acronym. Marie, you can come up. Chicanes is the New York State Community Health Center Association. And Marie is our Vice President of Policy and a fierce advocate for health centers along with behavioral health services for children.
Thank you, Karen. What a treat it is to be here today, visiting Oak Orchard for my first time. 6 years ago, my husband and I uprooted our lives to take an opportunity in upstate New York. We were excited for what could possibly happen and a brand new job opportunity for both of us. Once we moved to upstate New York, my husband's job opportunity was ripped away. We suddenly were left with a single income in a new town with no friends and a brand new rent to pay. We struggled. We struggled for months. My husband's confidence was shot, and I began supporting him in ways I didn't anticipate, and I wasn't taking the time to support myself. Gently, some friends suggested I get some help, some professional help. I was so blessed to find a licensed clinical social worker in my community that was accepting new patients. We started right away, and I got that support. We dug ourselves out of a dark time together, one that I couldn't have done if I didn't have the opportunity to lean on a professional that heard me, that listened to me, and that provided me with the tools to dig myself out of that hole. It inspired my husband to seek his own help as well, which quickly yielded in a new job opportunity, an even better job opportunity. Cut to 6 years later, and I'm here with Chicanes, extremely happy and thriving, and I continue that support with that same licensed clinical social worker. This is the value of good behavioral health care. I'm not a child, nor do I live in a rural community. Considering the vast openness of this community and all the communities that I drove through to get here, it's astounding the work that Oak Orchard Health is doing to expand access at a pivotal moment for children and adolescent mental health. We should be so proud of what Oak Orchard has accomplished here today. Yet, it's a difficult time. Our health centers are facing financial strains unlike those that they felt in the past. I hope that all of you will join me in sharing your story and your connection to Oak Orchard Health, to good mental health care, so we can ensure that our state policymakers continue to provide the resources that allow organizations like Oak Orchard to expand health in this way. Thank you so much for being here with us today, and I'm so, so grateful, Karen, to be celebrating the amazing accomplishment of this new wellness center.
Wow, that's great. Well, this kind of wraps up our presentation for today. Thank you everyone for attending.